Hi everyone, an investment in knowledge pays the best interest. In this video, I am going to deal about anatomy and physiology of female internal genital organs. The internal genital organs in female include vagina, uterus, fallopian tubes and the ovaries. Okay, so internal genital organs are mainly vagina, uterus, fallopian tubes and ovaries. First we will study about the vagina. The vagina is a fibromuscular-membranous sheet communicating the uterine cavity with the exterior at the vulva. So, vagina is the organ. It is communicating the uterine cavity outside at the vulva. It constitutes the excretory channel for the uterine secretion and menstrual blood. Through the vaginal channel only, there is a flowing of the secretion from the uterus as well as the menstrual blood. It is the organ of copulation and forms the birth canal of parturition. So this organ involves in the sexual intercourse and it also forms the birth canal of parturition. Parturition means it is the action of childbirth. So vagina, it involves mainly in the action of copulation and in the action of childbirth. If you see the diameter of the vaginal canal, it is about 2.5 cm. And it is being widest in the upper part and narrowest and narrow at the introitus. Introitus is the lower part of the vagina. So at the upper part of the vagina it is widest and the lower part it is narrow. It is called as introitus. It has got enough power of distensibility as it is evident during childbirth. As the vagina is having maximum distensible power during the process of childbirth, it stretches and it allows the baby to come out. Now we'll see about the walls of the vagina. Vagina has got an anterior, posterior and two lateral walls. The anterior and posterior walls are opposed together, but the lateral walls are stiff when compared to the anterior and posterior wall, especially at the midline or middle of the lateral wall. Okay, so anterior vaginal wall are there and posterior vaginal walls are there and lateral vaginal walls also there. Anterior and posterior vaginal walls are opposed together. Lateral vaginal walls are stiffer at the middle when compared to the anterior and posterior vaginal wall. The length of the anterior vaginal wall is about 7 cm. The length of the posterior vaginal wall is about 9 cm. This was all about the walls of the vagina. Next, coming to the fornices. What is fornices? Fornices are the clefts formed at the top of the vagina due to the projection of the uterine cervix through the anterior vaginal canal. Where the uterine cervix is projected into the vaginal wall, there is a formation of clefts. Those clefts are called as fornices. There are 4 fornices, one anterior, one posterior and 2 lateral. The posterior one is being deeper and the anterior one is most shallow. Now we'll see about the layers of the vaginal canal. The layers are arranged from inside to outwards. So the inner layer is mucus coat, which is lined by stratified squamous epithelium. It does not have any secretory glands. And second one is submucous layer. It is of loose areolar vascular tissue. And the third layer is muscular layer consisting of inner circular and outer longitudinal muscles. And the fourth layer is fibrous coat. It is also highly vascular. So there are 4 layers mainly arranged from inside to outside. First is mucus coat, second is submucosal layer and third is muscular layer, fourth is fibrous coat. So these are all the layers of the vaginal wall. Now we will see about vaginal secretion. The vaginal pH from puberty to menopause is acidic. Puberty is the period during which adolescents reach sexual maturity. Menopause is the point in time when menstrual cycle permanently stops. So from puberty to menopause, the medium of vagina is acidic. It is acidic because of the presence of DODERLEIN bacillus. DODERLEIN's bacillus is also called as lactobacillus, which is found in the normal vaginal secretion, which produces lactic acid from the glycogen present in the exfoliated cells of the vagina. Exfoliated cells are the cells which are shed from the surface or layers of the vagina. The pH of this lactic acid varies with the estrogenic activity and ranges between 4 and 5. Based on the estrogen hormone activity, the pH of the vaginal medium is varies and it ranges between 4 and 5. That's all about the vaginal secretions. Now coming to the blood supply. Blood supply to the vagina is by the arteries and veins. So arteries involved are cervicovaginal branch of the uterine artery. This is the first one. Okay, first is cervicovaginal branch of the uterine artery, and second one is vaginal artery. Vaginal artery, it is the branch of anterior division of internal iliac artery, and third one is middle rectal artery, and fourth one is internal pudendal artery. Okay, so there are four arteries which are involved in the supply of blood to the vaginal medium. First one is cervicovaginal branch of the uterine artery, second one is vaginal artery, third one is middle rectal artery, fourth one is internal pudendal artery. Now we will study about the venous drainage. Vein drains into internal iliac veins and internal pudendal veins. Okay, internal iliac veins and internal pudendal veins are involved in the venous drainage. Now we will see about nerve supply. The vagina is supplied by sympathetic and parasympathetic nerves from the pelvic plexus. The lower part of the vagina is especially supplied by the pudendal nerve. Okay, so vagina is supplied by sympathetic and parasympathetic nerve fibers from the pelvic plexus. Especially the lower part of the vagina is supplied with pudendal nerves. This was all about vagina. So in vagina we have studied what is vagina, what all the walls are there in the vagina, fornices, structures, secretions, and blood supply, venous supply, nerve supply. In my next video, let us study about uterus. Till then, signing off, Hemlata.